Welcome to our module on Diabetes Basics. This presentation is for educational purposes only and not for medical advice. Here are some of the topics we will be covering in this video. What is diabetes? Common terms and phrases in diabetes, types of diabetes, and lastly, complications of diabetes. So, diabetes. What is that? Diabetes is when your body has trouble turning your food into energy. Starting with some common terms and phrases. Blood glucose, sugar, insulin, pancreas, diabetes mellitus, and gestational diabetes. When you hear of diabetes, you may think of sugar. However, your doctor may use the term blood glucose. Sugar and blood glucose are basically the same thing. When you eat, your body turns the food into sugar. Your doctor measures this sugar by getting a glucose. Next is insulin. Insulin is what helps your body use this sugar as energy. The pancreas is an organ in your body that makes insulin. As mentioned earlier, diabetes mellitus is a problem in the body's process of using sugar as energy. There are two main types of diabetes mellitus, type 1 diabetes mellitus and type 2 diabetes mellitus. As a side note, in addition to types 1 and 2, there is also a kind of diabetes called gestational diabetes. This occurs during pregnancy, and we won't be focusing on it here today. Alright, time for a checkpoint. Diabetes mellitus occurs when there is a problem in the body's process of using blank as energy. So diabetes mellitus occurs when there is a problem in the body's process of using sugar as energy. As we have said before, there are two types of diabetes mellitus. Type 1 diabetes is where the body attacks the pancreas and can no longer make insulin. Without insulin, your body cannot use sugar as energy. Although type 1 diabetes cannot be prevented, it can be controlled. Insulin can be prescribed by your doctor. In type 2 diabetes, your pancreas can still make insulin. The problem is that your body no longer wants to use the insulin. Type 2 diabetes can be improved with lifestyle changes. See our diabetes prevention and control video for more tips and tricks on this. Your doctor may also prescribe medications to help the body use its insulin again. Time for another checkpoint. Which type 1 or 2 diabetes, occurs when the body no longer wants to use the insulin the pancreas is making? Type 2 diabetes occurs when the body no longer wants to use the insulin the pancreas is making. Finally, we will go over some complications associated with diabetes mellitus: hypoglycemia, hyperglycemia, neuropathy, and retinopathy. Hypoglycemia occurs when the blood sugar drops too low. This can be due to medications or decreased food intake. Signs of hypoglycemia can include, but are not limited to, headache, dizziness, shakiness, inability to make decisions, and irritability. If you think you are experiencing this, seek medical attention. Hyperglycemia occurs when the blood sugar rises too high. This can be due to increased sugar in the diet or not using your medication. Signs of hyperglycemia include, but are not limited to, increased hunger, increased thirst, increased urination, agitation, nausea, and blurry vision. If you are experiencing any of these symptoms, please seek medical attention. Neuropathy describes a loss of feeling in your hands or feet. Early signs of this may be inability to feel temperature changes or sensation, such as when you put your feet in the shower or when you wash your hands. Ask yourself, am I unable to tell the difference between warm or cold water? Can I feel gloves or socks when I put them on? These may be key signs to tell your doctor. If not addressed, neuropathy can lead to serious infections and even loss of limbs. Lastly, another complication seen is retinopathy. This is very serious and can result in vision loss. Early signs to discuss with your doctor may include seeing floaters, blurry vision, and dark spots in your vision. Okay, time for our last checkpoint. What type of glycemia, hypo or hyper, occurs when the body's blood sugar drops too low? Hint: some signs may be headaches, dizziness, inability to make decisions, and irritability. Hypoglycemia occurs when the body's blood sugar drops too low. In summary, diabetes mellitus occurs when the body cannot use sugar as energy. There are two types of diabetes mellitus. In type 1, the body cannot make insulin. In type 2, the body cannot use insulin. Here are some complications, which include hypoglycemia, hyperglycemia, neuropathy, and retinopathy. That's all we have for today. Want to learn more? Follow these links for helpful information on diabetes.